discussion. You're ready? Yeah. He's eager to open the innings.
I'm very pleased to see so many people here looking and listening about healthcare corruption. I must say it's a subject which is quite close to me because I am probably part of a long-lost generation of Indians who were born into privileged families and who had education in the best schools and the best universities in the world. But we had, because I think of Nehru, a very strong patriotic zeal to come back and help India become a great nation. And so after many years in England and America, I tried to get a job in India. And the chairman of surgery at the All India Institute came, and he was feted regally, and he said that he'd give me a job. Needless to say, there was no job. The second time, there was an advertisement. And my wife, who was doing a PhD on an important subject like, the change of family structure in West Bengal at the turn of the century. And she saw an advertisement, and she told me, and I was at Massachusetts General Hospital, Harvard Medical School, to apply. I applied. When I came, I realized I came to see what India was like, in fact. And I stayed with a friend of mine who was press secretary to Mrs. Indira Gandhi. And he said, "Have you come for the interview?" I hadn't got the message to come. And when I came down the next morning, he said the interview's the next day, and he was ringing up every single person on the selection committee. And he said, "A friend of mine has applied for this job, and I'm press secretary to Mrs. Indira Gandhi, and I would be grateful to see that justice is done to him." So I duly got the job. I said, "I don't want the job under these circumstances." He said, "You'll never get the job unless you have to accept this." So I started on the wrong foot. I joined the All India Institute as an assistant professor. My wife was a very strong patriotic person, and we got 900 rupees a month. We stayed in a very small flat of 700 square feet with an Indian-style lavatory, which took 3 months to change because of bureaucracy. But I loved the job. It was very interesting. The patients were poor, very interesting problems they had, and they were inordinately grateful for little things you did for them. There was, of course, a background of corruption. The corruption was manifest as doctors running after politicians, going to their houses, and one person who was on the selection committee told me, who's my patient, that 70% of the faculty used to come to his house to ask him for favors, canvassing for promotion. And really, I thought, well, this is India, I like the job, and I don't want to give up. And needless to say, I didn't get promoted anyway. I stuck at assistant professor for 12 years. What really changed? Gradually, I crept up the ladder, and I really loved the work in the All India Institute. But what brought light into my life was an article by Dr. David Berger who worked in the Himalayas in Landau, and he said that corruption pervades Indian healthcare. He said that while he was writing a prescription for an ECG, a junior doctor said, "I'll do it." Why? Because he will get a kickback from the ECG person. And he said that this is a terrible thing and something should be done about it. And I think that I wrote an editorial in our journal called Current Medicine Research and Practice. This was taken up by the British Medical Journal. And Dr. Kamran Abbasi, who was the deputy editor of the British Medical Journal, Anita Jain from Bombay, and I wrote an editorial about corruption in Indian healthcare. This was taken up by all the newspapers, and the health minister said, "It is true that there's corruption in Indian healthcare. The MCI is a den of vipers. We should get rid of it." And now the whole thing has snowballed into a big issue. Oxford University Press then said, "Why don't you edit a book on corruption?" And since I didn't know enough about healthcare, I asked my friend Keshav Desiraju, who had been an outstanding health secretary and a straightforward health secretary, to join, and Sanjay Nagral from Bombay. And we asked a large number of people, and I don't think anyone refused. We wanted to put corruption in healthcare in a kind of academic background, as well as have personal stories. And in the end, we said that we should not end by being pessimistic. We should also highlight what has been great in this country. And I think that there are many institutions like the Banyan, Christian Medical College, Vellore, the Wardha, all these places have been outstanding beacons of hope. And not only that, I think that in the middle of healthcare corruption, we have produced some great doctors. Of course, there have been other people will say differently, but I think in my experience, the great people I remember are Dr. A.K. Basu of Calcutta, Dr. N.H. Anthya of Mumbai, and of course, Dr. P.K. Sethi of Jaipur, of the Jaipur Foot. I am really very pleased and grateful to the Hindu and Mr. Ram for hosting this occasion, because I think that the Hindu is one of the only newspaper in India that I admire, and I read nearly from cover to cover every day. Thank you very much for coming.
Thank you, Dr. Nandi. And may I now...
Thank you, Mr. Raman. Thank you, everyone, for coming to this evening's function. I'd just like to say a little bit about the context. Dr. Nandi has explained that the idea for this book really came from a lived experience of corruption, as it were, at various levels. But there are a couple of points which I would just like to flag. Now, our book is called Healers or Predators, and it somehow gives the impression that it is only doctors who are responsible for corruption. Now, this is not at all the case. The fact is that the public health ecosystem, as it were, doctors do make up a very, very important and essential component of that. But it also includes health policymakers. It includes regulators, such as the Drug Controller General of India or the Medical Council of India, the Nursing Council of India. It includes a range of miscellaneous service providers without whom the health system itself would not function. And very importantly, it also includes the public in the sense that these are the public in the sense that, this is screaming at me if I go any closer to it, the public in the sense that it is their expectations of a public health system that is very important. What is it that people want? And is our system delivering what people want? So I would not like this impression to stay that it is actually that the whole problem is with doctors and settle the problem of corruption in the doctor establishment and you've done what needs to be done. Not at all. Health regulation and health policy making are also very crucial, and it is corruption in those sectors, and we do the discussion on Vyapam, for instance, is a very fine example, a detailing of what happens when the entire system from within begins to rot. Several pieces pick up on the Medical Council and what the Medical Council has not done, and as all of you would know, there has been a very recent development in the history of the Medical Council. You know, any sector you go into, you will find any area where there is government expenditure, you will find instances of reckless corruption even. So we are not at all making the case that the medical sector, the healthcare sector is somehow uniquely susceptible to corruption. Not at all, but it's a sector that we felt we knew a little about and could therefore address more comprehensively. The third set of issues which I do believe we should talk about, which I think the book pushes us towards, is so what happens? Because many of the pieces in this book, people speak from experience. People have been actually extremely forthright, even courageous, in actually saying what happens and the kind of experiences they've been through and the way in which corruption in real life takes place in this sector. So the question is, well, where do we go? We can't just keep bemoaning the fact that there is widespread corruption. Where and how is this corruption to be stemmed? And this is where I do believe health policy makers need to actually think about it. We hear a great deal these days from health policy makers about Ayushman Bharat. Now, I have no problems with Ayushman Bharat. It's a fairly well conceived program, but there are a very large number of unanswered questions. And the way in which it has been structured, Bharat that is, does nothing towards addressing the specific points at which corruption has been known to occur. We have basically, we still have a system where everything depends on a limited number of people providing a scarce resource, which is healthcare. All the corruption that we see in healthcare comes from the fact that a limited number of people need to provide an essential service to a very vast population. And as long as this imbalance continues, that situation will continue the corruption situation will continue. And Ayushman Bharat, I fear, the way it is currently structured, does nothing to redress the imbalance between a limited number of providers and the very large number of people who may need the service that they are providing. And absolutely one last point I want to make, which is again that in discussing the question of healthcare corruption, we have to face, the one big question we have to address is corruption more in the private healthcare sector or in the public healthcare sector? There is no dispute that corruption exists in both sectors. But where is it more and where is it more likely to be damaging? It's a question, there's no easy answer to this one. We are all familiar with instances in both the private and the public sector in healthcare. And I think this question is going to be with us for some time. We need to find ways that address, because there are different factors that cause the corruption in the public and the private sectors, and how best do we go about addressing those? Thank you.
Thank you. Thank you very much. I now request Dr. Mani. He has a contribution in the book, a chapter called Corruption and Everyday Medical Practice. And I think he will speak to that chapter and what he's observed.
Actually, Ram, I don't mean to speak to that chapter. There are many other things I would like to speak about. I have perhaps a position of vantage over here because at a glance, I think I am the second oldest person in the room. I'm aware of one person who is older than I am. And what I would like to say is that none of you could have reached your present age without having come into contact with the medical profession in some way or the other. So what we're mentioning in this book is something that you would have come across anyhow. You would have met it somewhere or the other. It's only put together and documented over here for you. A couple of points that we should establish. It's not our idea that we should give you the impression that except for the contributors to this book, all the other doctors in the country are corrupt. That's not true. There are a large number of people who are doing an excellent job and working extremely hard on that. The second point I'd like to say is, which has already been mentioned, is corruption does not exist only on our side. A significant amount of the corruption comes from you. And I find that many people are quite ready to go on and criticize the medical profession, but they want certificates, which may not be entirely true. And they want insurance, which very often, most people in this country fall ill, get an illness which requires a lot of expenditure, then bluff the date on which they got the illness. They take an insurance policy. They come to the doctor and say, now, I got it from so many years ago, but on your notes, please make sure that I got it only 2 months ago. And that's a very common thing. I can tell you as a practicing doctor, it is routinely done. How are we going to rectify this? That is the major problem. It's easy to point out the defects. I don't know how we're going to rectify it, and I'm rather pessimistic about all that we would like to do. Obviously, you need a strong and straight regulator. The Medical Council of India, which was supposed to look after all that, is actually a cesspool. And I don't know what is going to come of the desire to, or the intentions talked about of reforming all that. Basically, we are not a people who respect rules or laws. You just have to think of all the posters, the placards, which we have on the pavements the last 2 days. There are rules which say you should not do it. But what's the rule for? Just go down the road and see how many of the motorcyclists are wearing helmets. Most of them, I see, today I saw quite a few people who have a helmet, but it is on the petrol tank. So I presume the petrol tank of the motorbike will be well protected and is not going to have any problems. I thought that the way that we should make a beginning is that we have to look after healthcare for the poor. The rich somehow or the other will manage, and they may be able to also take remedial action if they find somebody who is very corrupt dealing with them. We must strengthen the public hospitals. When I was a student, and I admit that that was prehistoric days, many of you may not be aware of those, in those days, the place to go when you were seriously ill was the government hospital. You may go to a nursing home to have minor surgery under comfortable conditions, but if you had something seriously wrong, you went to the government hospital. Government has abdicated its responsibility to maintain a center of excellence for looking after the care of people. Maybe the All India Institute is an exception. It is widely regarded as one of the best hospitals in the country. But I can tell you definitely that at least as far as this state is concerned, the government hospitals are no longer the leaders. I don't find any sense in these government insurance schemes, which are very good vote-catching schemes. Andhra Pradesh started it. All the southern states have taken it up. Now the central government has also taken it up. So what are we going to do? Spend government money, which will go to the private sector. The private sector has enough money on its own. There is no necessity for government money to be spent going to the private sector. I don't understand why the money that government spends on the insurance cannot just be spent on improving the facilities in the government hospitals. Don't have this kind of an insurance system at all. In my days, people with an income below a certain level were treated free at the government hospital. If their income was a little higher, they were charged a little bit, not too much. If you were really wealthy, you went to the upper class wards and you paid a lot for the treatment over there. What I feel is that the only way we can improve the government hospitals is if we insist that all those who get paid by government for their health care should get that health care at the government hospital and nowhere else. Everybody has a right. Everyone has a right to go to the doctor whom he chooses and to go to the hospital that he chooses. But he should pay for it. If he goes, and this I apply particularly to the senior government officers and the ministers, why should they get government money being spent at a private hospital for their care? Years ago, I had a fairly famous government person who consulted me, and the first thing I asked him is, why are you coming to me? I'm at a private hospital. You run a hospital yourself. Why don't you go to that hospital? And he told me, so I said, why is that not good? You're running it, make it good. And the only way that it'll get good is if you people all go there. You all go to the private sector. You don't bother about what is happening in the government hospital. When I was a junior doctor, Bhaktavasalam had a fracture. He came to the government hospital. Bhaktavasalam was Chief Minister of Tamil Nadu at that time. He had a fracture. He came to the government hospital. We had a lift which had not worked for 1 year, and he got admitted in a ward, which meant that the convenient way of going up was taking that lift. Overnight, that lift worked. This is what will happen if all ministers and all government servants go only to the government hospitals for treatment. And that is what I think we should try to insist on. I don't see how we are going to get people to do that. It's a very ambitious idea. But somehow or the other, if we can exert pressure to see that at least for that government hospital should come up, people, and the only way that it will come is if we can make sure that if these people go to any place other than the government hospital, they should pay for it themselves. And that is the way that I think hospitals will improve. The only way we can get it is by public pressure. All of you should exert that pressure on your leaders and your rulers to see that this is the thing that they should do. The government hospital must improve, and it can improve only if they go there and see what is actually happening over there, not just go on an inspection. When I was an assistant physician, we used to be told we had 18 beds in the ward, 50 odd patients lying on the floor. And we used to be told, health minister is inspecting tomorrow, discharge all the patients. So when the health minister came, he saw a clean hospital, 18 beds, 1 or 2 of them empty, all the doctors comfortably. He didn't see us crawling under the bed to find a patient, to examine him, to administer a drip to him while he's on the floor. They're never seen by the ministers. So this is what we should make sure. If the minister himself gets admitted there, he will know what is actually going on. Thank you.
May I now invite Dr. Thomas to speak his opening remarks. He has a chapter called The Consequences of Corruption in Healthcare.
In a way, I represent R.K. Lakshman's common man, because when I was still a student, Dr. Samiran Nandi and Dr. M.K. Mani were already famous. So I actually met Dr. Samiran Nandi in All India Institute when I was a postgraduate student in Trivandrum Medical College. When this topic of today's meeting has, it's been sent around on WhatsApp group, and one common response among doctors is that we should go there and, or rather, we should boycott this meeting. We should not have anything to do with this. And I'm sure a lot of doctors are going to ask me, why are you here? Okay, because this posed in this binary fashion. Either you're a healer or you're a predator. You can either be one or you can be the other. And they will say that people like Dr. Samiran Nundy, he has pedigree. What difficulty for him to be a healer? What about a person like you, who studied in a government medical college, came from a very reasonably okay family, didn't have a lot of what they call in Tamil Nadu background? What are you doing in this company? They are talking hot air. They don't know what the struggles of doctors are. And how can they call us predators? This is a common question that all doctors who hear this topic ask. And I was rather sad. I didn't know the title of this book before I contributed to it. Otherwise, I would have objected to this title. Okay, because there is a huge gray area between healer and predator. Lots of doctors may not be healers, but not all of them are predators. In fact, as many of them have very gently remarked, and I'm putting it very vehemently, most doctors are not predators. Okay, we have to think about, but are a lot of doctors corrupt? The answer is yes. And is there the only corruption, money corruption? Is only finance corruption? I would beg to differ. There are all kinds of corruption. There is corruption for fame. There is corruption for wanting to be up on the stage, speaking with Nundy. There is a corruption of wanting to be selected in All India Institute without paying money for it. There is all kinds of corruption. And they will say, they can easily speak. They never had to struggle for anything. We had to struggle. So we have to understand the ecosystem of corruption. You know, when doctors ask, some of them ask me, you know, doctors are not a happy lot. You go to any conference, they always complaining. And ordinary people wonder, what have they got to complain about? They have a wonderful life. But it's because they also have this pain in their heart that they are not doing what they set out to do when they became students. And that's because most of the students who were with me left the country. You know, when we were young, we started a group called Medical Action Force. It was for medical ethics. We were only in the 20s then. One of them, only surviving member of the group other than me is Dr. Amalur Pavanathan, who's sitting there in the second row. All the rest have emigrated. They're either in the US or the UK because they found it much easier to be ethical there than in India. But we struggled on and somehow managed. So the question is, what is it that removes this fair amount of desire to be of use to the society when they are students, and it changes when you come out of the college? If you study in a normal college, not in the All India Institute, 70% they export them. They go some other country. They don't stay in India. If you study in Kilpauk Medical College like I did, do post-graduation in Trivandrum Medical College like I did, what makes the change? And I would humbly suggest that the change is the fact that we have two systems of medical care in India. We have the private system for those who can afford it. Probably not a single one of you. If you come to me as your doctor, you have to have faith in me, that I will do what is right. So I have to live to a higher standard of excellence than any other person. An engineer who builds a bridge which collapses, sure, but it's far removed. So you don't have that personal touch. And the personal touch is what makes medicine exciting. It's also what makes you expect more from the doctor, and it's also what makes necessary for society to protect the doctor. Make sure it can be done right. And present Indian society doesn't permit that.
Clinics and in public and private medical colleges, quote, remain true to their calling. And yet, the central issue dealt with in the book is corruption, as broadly understood and also very specifically understood. There's a great deal of detail and specific insights in this book, which I recommend to people who may wonder whether it's just hot air. But having said that, may I turn to the editors first of the book. The issues the book touches upon, Dr. Nundy, low allocation of resources. Amartya Sen has something to say that it is an important factor, but it's only one of the relevant factors. Kavita Narayan characterizes our healthcare system as a broken system. And Amartya Sen refers to a comprehensive healthcare crisis. Of course, we can say this about other sectors like the public school system, the justice system, and so on. And then about the everyday corruption, Dr. Mani in his chapter has many examples of it, so do some others. So you can say that there's everyday corruption, what is often called by corruption research as petty corruption. It's not really petty, it adds up, but everyday transactional petty corruption, and at the other end, grand corruption. And then you have a lack of trust, and also Dr. Thomas has dealt, among others, with the outcomes. Why did you focus on corruption as the central issue to be tackled, and that in effect corrodes the whole healthcare system? Is that accurate, or would that be considered an
didn't succeed. Give the best treatment in the world to the poorest of the poor. The poor were very grateful for whatever you did for them. The problems in India are huge, but the solutions are at hand. The problem is that we don't attack the solution, attack the problem in a very kind of intellectual way. And the reason that I thought that we should have a book on corruption was mainly because of David Burge's knowledge between a person who... I think that we are in a privileged